Were you told that you might have a premature baby and are terrified and don't know what to expect? Stick around and I'll tell you exactly what you need to know about having a premature baby and the challenges they might face in the NICU. Hi there, my name is Iman, and on this channel I teach moms and their families all about their high-risk pregnancy and the NICU to decrease fear and increase confidence. Having a premature baby is something that no one prepares you for because usually it's a surprise. A pregnancy complication usually comes out of nowhere and no one is ever ready. A premature baby is considered a baby that is born earlier than 37 weeks. This is because before 37 weeks, there are many organs and body systems that are still premature and are not functioning the way they should be. So if a mother goes into early labor, or if there's a pregnancy complication that forces the baby to be born early, which happened to me, and the baby is less than 37 weeks, then that baby will be going to the NICU, which is the Neonatal Intensive Care Unit. But this is not always true. I have seen and heard of babies that are born between 35 to 37 weeks, which we call late pretermers, and they don't go to the NICU. Instead, they stayed with their mom. This depends on many factors if the baby that is born less than 37 weeks will be going to the NICU or not. These factors include how the labor went, the baby's breathing at birth, the baby's weight, and the judgment of the main neonatologist. Therefore, the rule of which babies go to the NICU or not differs from hospital to hospital, country to country. So double check with your healthcare team in your hospital on the guidelines of when your baby would be actually considered premature and would have to go to the NICU. Even in my hospital, we have changed the guidelines since the last 8 years I've been there. Now, we admit babies that are born under 36 weeks and are born less than 2250 grams. Comment down below if you had a baby or know of a baby that was born between 35 to 37 weeks and they were able to dodge the NICU. So if you have a baby that was born really premature and they go to the NICU, there will be challenges they face. But in this video, I want to focus on the 5 main challenges that most babies face that all parents should know about. But before I start, I need to give a big disclaimer that these topics/challenges are big and heavy, and these topics might be too hard to hear. But remember, mom and dad, knowledge is power. The more you know, the more you can be involved in your baby's care and be the best advocate for them. So it's very important for you to learn about these topics and understand how best you can help your baby. Okay, let's get started. So the number 1 challenge is an underdeveloped brain. These babies are not able to breathe on their own, so they will need a breathing machine like a ventilator or a CPAP machine, which gives pressure to the lungs. Underdeveloped brains cause premature babies to forget to breathe. So they will have lots of apneas and bradycardias. This is very common for all premature babies and is usually treated with medication, and they often grow out of it. Last but not least, the risk of a brain bleed, which is also known as a IVH. And this is because their brain vessels in their brain are so fragile and so sensitive. So any life-saving medical interventions that are done on them can increase the risk of a brain bleed. The NICU team, your NICU team, knows this. So they do everything they can to decrease any unnecessary interventions that need to be done. They only do what's necessary to keep your baby alive. Number 2, the lungs are underdeveloped. Getting 2 shots of steroids before you deliver really helps your baby's lung develop faster and helps ease their NICU journey. Most premature babies, because of their underdeveloped lungs, will need some sort of breathing machine, either a ventilator, a CPAP, or nasal prongs. Stabilized breathing is one of the main priorities for any premature baby's care. So the earlier the baby is born, the longer they tend to be on a breathing machine. But most babies do eventually come off it. The 3rd challenge is feeding. The premature baby's stomach is very fragile and sensitive, so breast milk or donor milk is the best option to feed. Breast milk is the easiest for them to digest and very gentle on their stomach. Also, A premature baby is usually on a lot of breathing support. So a lot of the air that's going to the lungs to keep the lungs open is also being pushed down to their belly, which can cause their belly to get big really fast. Nurses and doctors in the NICU watch the belly very carefully because the belly can change really fast. Also, premature babies don't know how to feed by mouth. They need to learn this skill. They need to learn how to suck, swallow, and breathe. But until then, they will be feeding through their feeding tube, either in their mouth or in their nose. So if your baby is wanting to suck, you can always offer a dry soother to get them to learn the coordination of sucking, swallowing, and breathing. And then also reflux. Reflux. This is a big topic in the premature community, the NICU community. And this is because reflux tends to follow the baby even after they go home. Reflux happens because the sphincter between the esophagus and the stomach is really weak, which can cause the acid in the stomach to go up the esophagus. Reflux in the NICU can cause lots of braddies, lots of DSATs, and babies to just not do well with it. Some babies might need medication to help deal with their reflux. Number 4 is temperature. Really small babies cannot regulate their body temperature because of their premature brain. They lose heat really fast from their thin skin, and they're not able to produce enough heat to keep themselves warm. Therefore, premature babies are in an isolette, which is, I'll insert a photo here. The isolette keeps them warm until they can grow big enough to keep themselves warm. It's very important for premature babies to be warm because they can focus on growth. Whenever a premature baby gets cold, that's added stress to their body and added energy that they will be using to keep warm, so they won't be growing. So staying warm equals to growth. So this is very important. Temperature is critical for these premature babies. Number 5 is infection. A premature baby's immune system is very weak. So when they do get an infection, they can get very sick fast. This is why there is constant hand washing, wiping of everything in the NICU. We wash our hands until sometimes they get like raw. NICU parents know this, NICU staff knows this, but it's very important to constantly wash our hands, to wipe everything down, because infection can be really detrimental on these babies. Also, breast milk is one of the key factors to help fight infection, and it gives these babies extra antibodies to strengthen their immune system. An infection can make a premature baby very sick and set them back because they might need more extra breathing support and they might be too sick to eat well. On the bright side, mom and dads, these babies are fighters and they're very resilient. They might get sick fast, but then they also heal very fast too. They are very strong. So never give up hope on your baby if they're having challenges right now. Premature babies have unique challenges from being born early, but one of the critical moments of their life is the admission process when they first enter the NICU after birth. Specific actions have to be done by the healthcare team to save their life and to stabilize them. Check out what exactly this process is in the next video.